In this video today, we're going to talk about herbal nutrition, supplements, and other things you can do to biohack your pain as well as decrease your likelihood of COVID-19 infection. Let's get started. Cutting Edge Pain Relief, the channel that teaches you how to biohack your pain and get back to doing what you love. So today we're going to talk about COVID-19, coronavirus outbreak and pain, and this is part 3 of our series in this regard. And today we're going to talk about herbal supplements and things that can be done in order to be able to provide yourself some degree of relief. Today, we're going to talk about nutrition in the context of how to be able to decrease pain and improve our overall immune health. But before we get into that, we need to talk a little bit about COVID-19 and how it infects cells. So COVID-19, as represented in this picture, is the little ball that has the S protein spikes that are present that's able to enter into the cells, typically the lungs, but it can enter into other epithelial cells by these S protein spikes being recognized by certain receptors. And right now what's believed is that the receptors that are the ACE2 receptors, or angiotensin converting enzyme, I know, fancy, but really not all that complex, that grab a hold of these spikes and really allow the cells to be able to find entry and then change and replicate within our cells. What we're going to talk about is ways to be able to decrease this connection and how to be able to improve our overall health as well as improving our immune health in conjunction. There have been a number of research papers that have looked at what to eat, and there's a mixture of traditional natural compounds and other compounds that are artificially made. We've decided to pick the top 3 naturally occurring substances that can boost immune health and provide some degree of pain relief. So when we look at those in order, number 1 would be something like luteolin, number 2 would be something like quercetin, and number 3 would be something like erythrodicetol. And so when we look at those 3, we're going to talk about each one in depth and detail, where you can find it as an artificial supplement, but better yet, where you can find it in natural foods. Luteolin is a group of naturally occurring compounds that's called a flavonoid. And flavonoids in general are really good substances to have around. They're found widely in the plant kingdom. It helps boost the immune system, and the ones that seem to be most prominent in terms of foods that contain it are going to be celery, thyme, green peppers, and chamomile tea, which has also been used for muscle relaxation and other elements that can provide both pain relief as well as improved immune system and function. Quercetin is probably one of the most abundant flavonoids in our traditional diet. It's estimated the average person consumes around 10 to 100 milligrams of it on a daily basis. And foods that commonly contain quercetin are going to be onions, apples, berries, broccoli, and tea. Supplements that also contain it are going to be things like St. John's wort, ginkgo biloba, and American elderberry. Erythrodicetol is a flavonoid that's found commonly in citrus juice as well as in the yerba santa root. It has anti-inflammatory properties, anti-cancer, it has neurotropic and antioxidant effects. So just an overall good flavonoid and item that would be useful to have within the context of our diet. So then turmeric curcumin is something that many people have heard of. It also has some excellent antiviral properties. It typically works through the inosine monophosphate dehydrogenase enzyme. And what it does is it has a rate limiting activity on de novo synthesis of guanine nucleotides, which is suggested as a therapeutic target for antiviral and anti-cancer compounds. So we talk about different herbs and dietary supplements. There are ways for to get what we need naturally in order to be able to boost our immune health, and there are ways to be able to supplement that if necessary. Traditionally, supplements are not as necessary as what we might think because our diets are traditionally more robust, and we've been told that they actually are lacking, but that's not typically the case. So, what we really need to be able to do is to understand how to be able to have a broad, balanced diet that provides us not only pain relief by using things like turmeric and curcumin, but also boost our immune health by taking in enough flavonoids that provide us with enough substrate that lets our body be able to have antiviral properties that prevent us from having the likelihood of being susceptible to disease. Thank you. Have a great day.